Hi there and welcome to Transforming Conflict in Dental Practices, a new perspective for high performing teams. Have you ever been in your practice and then suddenly feeling this extreme tension in the air due to conflict between two specific people? Perhaps you've even had to move those people into different surgeries so they actually don't have to work with each other. Needless to say, this is not ideal, and I want to explore in this article a kind of new, fresh perspective on how to look at conflict within your dental practice. Firstly then, let's start with thinking about understanding conflict and what are the sources of conflict. And I think there are probably four different potential sources. There can be many, but these are the general four. Firstly is differences in personality, style and approach. So difference in personality, difference in style can lead to conflict. When we're very different to others, this can lead to conflict. Number two is around just differences of opinion. Sometimes there can be really specific things that may be critical to your practice that people have very different views on. And when this is the case, this can really lead to conflict on this particular opinion, and that can really grow and evolve and become bigger and bigger. Thirdly is a lack of clarity around roles and responsibilities. Sometimes we kind of get people to fill in all different areas and do different things, which is helpful so everybody can muck in when needed, but we also have to have real clear roles and responsibilities, and sometimes it's not clear, and when there's overlap that can cause confusion and conflict. And then fourthly is just high pressure stress. High pressure situations, stress, this can lead to conflict in those situations. So those typically are kind of the four sources of conflict. And the impact of this is really significant on your practice. It will really low morale because everybody will get sucked into this conflict. People will feel it in the air and morale will plummet within your team. Secondly, this will likely lead to increased levels of staff turnover. It may be within that conflict, either of those people may end up leaving or both, and actually it just affects the overall team because it doesn't become a pleasant place and this to work, and this will potentially lead to other people leaving as well, again increasing staff turnover. And thirdly, of course, it will lead to a poor patient experience. Patients will pick up on this as well. Patients will pick up on this directly. Sometimes they may even witness some things going on between the individuals that they actually see, but if not, they will pick up on the atmosphere, right? So it really reduces the patient experience as well. So this is something that we really have to consider and think about, is conflict and how we work with conflict. I want to introduce, I guess, a fresh perspective on conflict, which is this: conflict is good. Yes, to repeat, conflict is good. And actually, for a high performing team, we want conflict. Now, how you define that conflict is, I guess, the most important point on what is conflict. But we want to have good debate and good discussion because it's the different perspectives, the different styles, different opinions. This all helps us actually make good decisions and move the practice forward, to bring things out into the open, discuss them and move them forward. Okay, so we actually want conflict. And I think there's a useful model to look at here, which is called it's almost like the conflict continuum, where at one end you have what is I call artificial harmony. And then at the other end is mean personal conflict. And actually Patrick Lencioni talks about this in his book, The 5 Dysfunctions of a Team. So, which says we want conflict. Conflict is critical to enable us to move forward, to discuss openly and to debate issues. But what we don't want mean personal conflict, and we don't want artificial harmony, where people are essentially pretending that everything's perfect when it's not. So we want this ideal conflict point, which is somewhere in the middle. And if we can create this environment where this exists, this is the way to look at conflict. So we want it, and we want this ideal conflict point. Not artificial harmony where there isn't any, but also not mean personal conflict. We obviously don't want that either. So we want to look at it from the point of view of conflict is good. It's required for a high-performing team. And it's finding that ideal conflict point for your team. In addition to that, the other element to this is around the importance of emotional intelligence, which is recognizing and understanding your own emotions within conflict and the emotions of others, which will be different. As an example, you may in conflict tend to kind of withdraw, right? That can be something that's perhaps not a helpful behavior in conflict. But at the same time, you may be very empathetic in conflict, which is a great behavior to have. So the more we can recognize and understand our emotions within conflict, both helpful emotions and perhaps not helpful emotions, the more we can also recognize others, and this helps us to deal with conflict better. So it's kind of this emotional intelligence that we can demonstrate will really help in conflict. The second part of that is just building empathy between parties, building empathy and genuinely listening. So having this conflict is important. It's important to have conflict, to find the ideal conflict point. And part of that is having real emotional intelligence when engaging in conflict. So this is the kind of fresh perspective I want us to consider when it comes to engage to conflict within your dental practice. All right. Then we do also have to recognize that there will be times when we have to really resolve conflict, and we have to look at effective conflict resolution techniques. Part of that is about creating this open, honest and direct communication as a way of working within your practice. To be open, to be honest and direct. If we can create this overall environment and really have this as a way of working, it will ensure that a lot of conflict, that any serious conflict, any mean personal conflict is essentially avoided. When there is real conflict that's escalating towards the mean and personal, we have to create a structured kind of problem-solving approach to it, to think about, well, what is the real problem that is ongoing here, and to identify that, to work between the two people to actually identify solutions and a way forward. It may be required that you become a mediator, or someone else who's an independent third party, it becomes a mediator between two people. That could involve bringing those people together in a room, sitting them together and outlining the kind of clear rules of engagement for that discussion, encouraging essentially those two people to talk to each other. They will probably talk to you first because they don't want to talk directly or look at the other person, but it's about you using your eyes and using your direction to encourage them to speak to each other directly and to work out ways forward. And finally then, it's about setting clear expectations and boundaries of how you expect people to communicate. What are the kind of rules of engagement for your team? And alongside that, practically checking that roles and responsibilities are clear, because this sometimes can be a real issue. Okay, so those are some real strategies to actually resolve conflict. But I guess the fresh perspective I want to get across on this is that conflict is good. For a high performing team, we have to have conflict. And it's about finding that sweet spot of conflict that is heated, good debate, challenging, so that you can progress forward. But we don't want it to be mean personal conflict, but we also don't want this artificial harmony where everybody's pretending everything's perfect and there's never any conflict. We want conflict. Engage in open discussion and encourage open and honest communication. Fresh perspective on conflict. Engage. See it as a place for growth and development for you, your team, and your practice. Bye for now.